I'm having an esophageal spasm. I use my nitroglycerin. It's right in my chest. It was pretty intense. It was like, it started around a 2, 3, and it went to a 5 really quick, and then I was able to get my nitroglycerin. Use my nitroglycerin. Oh, it's right again, right between my breasts. It's just right where that bone is. So collarbones here. Just go straight down. Feels like the top of the rib cage. The palm of my hand like covers that whole area. But it makes your body hurt all over. My arms. Especially that line here. But I used my nitroglycerin, 3 sprays under the tongue, and I'll be getting a headache from it in a minute. The only good thing is that now that since I've had these for so many years, I know that I can take my nitroglycerin and spray, and it takes care of it pretty quick. And they still come. It's like getting hit by lightning, but they're not. This one is not as intense, thank goodness. The nitroglycerin took care of it right away. And lots of times that in the past I would have to use the nitroglycerin. Don't know why it makes me yawn afterwards. Kind of like just the relief of that agony of pain being gone. But I do still have them. You never know when it's going to happen. I've just been relaxing, and it seems like maybe it came on because I was thinking about all the different chores around my house I need to do, and I'm obviously not in the mood to do those. But I don't know if it's anxiety of that. Sometimes I think it's the positioning, like having pillows propping me up. But the spasms are just, it really just squeezes you like a wrung out dish rag is how you feel afterwards for me. I hope that anyone that has them can at least try, have their doctor prescribe the nitroglycerin lingual spray. It's very inexpensive with my insurance copay. And I have a bottle of it everywhere. I carry it with me constantly in my purse, in my car. I have one at my parents' house. I have one in my glove box in the car and in the inner console of my car, as well as the one that I'm carrying in my purse. I have one next to my bed, so that wherever I am, I can just have it close to me. I will not go anywhere without the spray. Because if I don't, that spasm that lasted about a minute, because it started before I was able to begin filming, and I began filming after I'd already used the spray, it could last a really, long time, but because I was able to get the spray right away, it started to help it recede, and so the duration wasn't as long as it could have been. So I will not, it's like Popeye's can of spinach, I guess, except it doesn't make me strong, it just makes the pain go away. And then typically after the nitroglycerin, I do get this headache, but the headache is nothing compared to the spasm in the chest. Nothing. I believe that last video I filmed, because obviously this isn't really something you want to share with the whole world, but I share it because if you are suffering from this thing that I've only known as esophageal spasms, it's just so terrible that I just want anyone that has it to find relief. And I have had these more frequently lately. I would say in the last month, 2 to 3 per week. One happened the other day when I was driving home. I actually had to pull over on the side of the road and use the spray, and instead of just the dosage, which is 3 metered sprays, I had to use 5, and I leaned my seat all the way back. Of course, I stopped the car, turned off the engine. The whole thing lasted about 5 to 7 minutes, and then after 10 I was probably able to drive the rest of the way home. Excuse me. I think it makes me yawn just because of that squeezing. For some reason I yawn afterwards. But the having it on the road in the car was something I hadn't had experienced for a pretty long time. This is the middle of the day right now. It is 12:30. I haven't been real active today. Just trying to catch up on some sleep and then just do a few paperwork type things. And then I was thinking about, again, just all the many things that I need to do, and it seemed to bring, at least that was the precursor to the spasm. So I've had them when I was in the middle of a classroom teaching, in the middle of the day, in the morning, late at night seems to be a big time when I have them. So I'm glad that this one's gone. I don't think I'll have another one today. I don't usually, if I have multiple, it will be the continuation of one that starts and it just isn't able to become controlled. But again, the nitroglycerin spray looks like this. I'm sorry if it's backwards. It says nitroglycerin lingual spray. 400 micrograms per spray, 200 meter doses. This one is expiring in January of 19, but honestly, I have them as old as 2007 because I would rather have them than not have, just only have one bottle that I can go to. And yes, I've had to use the one of the older ones, 2009, 2012, 11. I don't get it refilled real often because, I've never used one up. Because if you can see 200 meter sprays, it's hardly gone at all. But it is worth its weight in gold. But I'm really glad it's available. And it says the manufacturer is Perrigo, Perrigo, and it looks like it's made in Ireland. Sorry, I don't have my special little cheater glasses on. This is my regular prescription, so I can't read that small, but I will put it down in the comments or the notes below. So I really hope if you suffer from these that you will get this. As you can see from that first video I posted of the esophageal spasm, this one that I just had was nothing compared to that one. That other one lasted, I think it lasted a couple of hours. And that's not typical anymore, because now, although I did have a spray with the other one, the nitroglycerin spray, it for some reason just didn't take care of that one right away. And I had to use it multiple times. That's happened where I've had to use the spray multiple times, but it's just so frightening. And I think that now, since I do know what to expect when I have a spasm, I know I'm not having a heart attack, I know I'm not dying. I can control it much quicker now. The worst part, I believe, is the fear of the unknown. So please ask your doctor to just let you try this if you suffer from these. I hope it'll be a solution for you. I went to my doctor last week, and we talked about these, and since I have had gastric bypass surgery, it's been 19 years ago. I had these esophageal spasms before I had that surgery. I had the spasms, they began when my son, who's now 20, was 1 month old. And they took out my gallbladder because they thought it was a gallbladder attack, but it wasn't. And so from then on, I've had these. And the gastric bypass I had 19 years ago when my son was 1 year old. So now I have lost and maintained over 100-pound weight loss. I had lost more, but then I gained some back. But they have never gone away, despite whatever size I was. And my doctor that I was talking to the esophageal spasms about last Thursday, a week ago tomorrow, said for me to keep track of what I ate to see if there was any association with eating. And funny, but I kind of wondered if maybe there was, but I have not eaten or drank anything in the last hour. And the only thing I had earlier was ice water, and I did take my daily medication with Diet Coke, but that was probably 3 hours ago. So I can't really relate anything to why this one just came on, other than me having some anxiety about things I need to do today, possibly. But I have noticed before, again, I said I was kind of in this scooched position, but when I'm in the throes of having one of these spasms, I just kind of want to like arch and stretch and make my body as straight as possible. But I was just laying here watching television and snuggling with my kitties. Here I am yawning again. It really is an exhausting thing to go through, these spasms. They just squeeze the life out of you. And they were just so terrible for many, many years until, with experience of having them and knowing that they are temporary. And having this nitroglycerin spray is, again, like the antidote for me. So please, please go to a gastroenterologist and see if they'd be willing to at least let you try it. But I've suffered with these on and off. I've gone as long as 6 months without having a spasm. But then I'll have, especially around times of a lot of stress, like the holidays, I've had them frequently, daily. So I could leave everything, my wallet, my purse, my keys, anything, but I will not leave my house without I won't leave out the country without this nitroglycerin spray. It's like the salvation, because these things hurt so bad. No pain medicine, no Tylenol with codeine or Percocet or hydrocodone. Nothing touches these. Nothing. They had given me, some kind of a barbiturate when I first had these. And a couple years later, I saw it was like the same thing that the veterinarian had prescribed for my overactive large dog. And all they ever did was knock me out, but they do not touch the pain. But what the nitroglycerin does is it relaxes the smooth muscle, and it is a godsend. I'm just so grateful that Dr. Frederick, who was the one gastroenterologist, recommended this to me, and it was a miracle because he had the insight to offer this to me, and I have never seen this as a solution because I don't have heart problems. People think nitroglycerin is for heart problem, but what it does is it relaxes the smooth muscle, and I don't know what it does to somebody with heart, except that it does. The reason you get a headache is it opens up, I guess, the arteries, and so you're getting more oxygen, and that's why you kind of get the head rush, which is, it's like nothing. It's like a caffeine headache, but it does have a quick onset. But I'm just so grateful, because that intense, horrible pain that is paralyzing. I've literally been on the floor, rolling on the floor, crying before with these, before I had the nitroglycerin. And so I suffered with them. My 20-year-old son, he was 1 when I had the gastric bypass, but I had these a month after he was born. And I did not get this until my last child, who's now 13. So about 7 years I suffered with the esophageal spasms with no relief, no idea of when they were going to hit me. Every time I'd be going to the hospital in the ambulance and they do a cardiac workup. Do not let this, for anyone who's watching, do not let this prevent you from getting a cardiac workup, because heart disease is the #1 killer. And I do not have heart disease. I've had the workup way back then, and I've had recent work. I've got excellent cholesterol, and the LDL levels are low. I do not have any heart issues at all. But that is always the first thing they check. So if you've had your heart workup and you still think you're having these spasms, it's right in the center of the chest. And the other day when I was in the car and I had the one, it did go down my right arm and into my back. So they even can go down into the stomach, which is very weird when it goes that low. But I guess obviously the esophageal tract will go into the stomach, because that's how the food goes into the stomach. But so that makes sense. But generally the pain is in that area, the palm of my hand, between the breasts, and just right that area right there, which is maybe, I don't know, a square of 4 by 4 by 4. So I hope this helps someone. I'm sorry for any rambling, but I did just deal with a very painful esophageal spasm, which is, if you see the other video, you can tell it's nothing like the severity of that previous one. But there is hope if you have these. So I just wish you the best, and I hope that if you are suffering, this might be something that helps you. So God bless, and feel free to leave your comments, and I will get back to you as soon as I can. Thanks and good luck.